not too bad, I would say. We'll see how she looks when she starts to move. What about Nathan here?
Well, that's a nice stretch.
Or do we start now?
It's all right.
Yeah? Okay. So the other thing to observe the muscle bulk is there's symmetry, asymmetry. Sometimes you pick up asymmetry, so can you tell with Nathan which one side is a little bit more prominent than the other? You have to be pretty close. So he has very prominent muscles on the right compared to the left. That could be, I don't know, it could indicate a rotational component, so I don't know what he's doing, but if he's doing a lot of rotation to the right side, then obviously the right side would be more felt. We don't see that with Ellie. You also want to do like what I call finger sweep, if you want to look at the curvature of the spine, so not just the lordosis, but curvature of the spine. So here we're looking at scoliosis or rotations. And if somebody has like obvious scoliosis, you can see that. And also you have them bent forward and you can see the rib hump. But here I'm talking about subtle changes in the spine. So I'm going to just go ahead and put 2 fingers, or rub 2 fingers through your spine. It looks pretty good. Not bad. Okay, can I try it on you, Nathan? Sorry. And he's just sliding off on his muscles, but nothing, I don't see anything obvious. But sometimes you can see a couple segments rotated. Now let's have them turn to the side, so both turn to your right side. And what about from a side view? Did you notice anything that we perhaps may have missed from the posterior view? I want to say just a little bit of, it's not quite exactly sway back, but it seems like Ellie's back is a little more like shifted posteriorly. Usually, do you guys know the definition of sway back? Create a sway back for her. It's kind of like this. So it's different than lordosis. So I'm looking at the relationship of greater trochanter to her shoulder. But she seems to be a little bit of a sway back. But the reason I'm not classifying her is because she has a rounded shoulder. So the shoulders are lined up with her pelvis, but her thorax is a little bit deviated or shifted posteriorly. Okay. And we can, with Nathan here, you can palpate PSIS and ASIS. Normally the ASIS are slightly lower than PSIS, right? But if they're excessively lower than PSIS, then you would suspect that he has a little bit of an anterior tilting posture. Now, he gives me that appearance, so I don't know until I palpate that. It could be because of his shorts, so don't get confused with that. Okay? All right. I don't see anything other than that. Of course, there are a lot of things you can observe up here, but we're going to keep our focus to the lumbar spine today, if that's okay. The other thing you want to notice with your patients, if they have like obvious deviation like that, remember we talked about it, shift or deviation. So if you pick that up, you definitely need to write this down and we'll try to correct it. So I need one of you to stay here. The other person can go and sit back down. We're going to go through active range of motion with overpressure.